like to tell you something about Shen and how to treat Shen and how the way is how Shen comes to the face. Usually before we start the treatment of a patient, we should have a diagnosis. And the diagnosis begins in the waiting room. If you see our patients the first time, if you see our patients the first time, we have an impression of his expression. We see him, we look at him, we look in his eyes. Perhaps we give him our hands and we speak to him. Good morning, Mr. Miller. My name is Kommt. And we look in his eyes. And so, in this way, we see the most important of every patient. The most important, which is very effective for the rest of the treatment. The rest of the diagnosis, the other part of the diagnosis, is to have an examination, to look to the trees, not to the forest. But in the first view, you have a view to the forest, you see the whole patient. And you have to observe what are the expression of the patient. And on the other side, what kind of feeling within you, within yourself. There's one kind of energy, one kind of Shen coming from the patients, and another kind of energy of feelings within you. Later, during the examination, you observe the details of the patient. You observe the skin, you observe the visible body, you observe the lines and wrinkles of the face, you observe the muscles and the movements of the whole bodies and the muscles of the face. The eyes and the general emanation are the expression of Shen. If you are looking to the muscles and to the movement and to the mimicry, you see the emanation of Qi. And if you observe the skin and tissues, you observe the expression of Yin, Qing, and Yang. Next slide, please. So there are different aspects how Shen comes to the face. The first aspects are the conducting channels. Shen comes to the face by using the channels. There are different channels, for example, names Tai-Yang, Shao-Yang, Yang-Yin, and the Yin channels. The Yin channels not directly arise at the face, to the face. They use the Qing-Bie. We speak later about this. And on the other side, there are vertical channels. The Luo-Mai, the Qing-Qing, the muscle meridians, and the Qing-Mai, the extraordinary muscles. Next slide, please. On the other side, other side too. Press escape. On the other side, the nourishing aspect, the production areas of the human body where qi in different kinds, different varieties is produced. There's a synergism of several functions and abilities, which is important for kosmetischen acupuncture. For example, the spleen takes care of the tissue. The kidneys takes care for the root and for the marrow, the root of the human being, and the function, especially for the blood. The heart takes care for the red color of the face and the tangibility by feelings. The lung is responsible for the chi, for the force and the movements. And the liver stores the blood and the muscles and responsible for the distribution. So we have different kinds of chis. Chi is governed by the lung, conducted by the liver, and conducted by the lung too, and executed by the muscles. If you have the disturbances of the chi, you have a skin with a thick skin with signs of stagnation of chi and chi deficiency. Next slide. Another kind of chi is the blood. Blood governed by the kidney, heart, and spleen. It warms the body, it moistens the tissue and the skin, allows the motility of the chi, and in the deficiency of blood, you have wind symptoms. In the face, you have a thin, dry, and itching skin. That's a sign of blood or yin deficiency. Or another sign you can observe a dark and blue skin or blue spots. That's a sign of stagnation of blood. The tissue is governed by the spleen. It contains yin and fluids and is responsible for the transformation of the fluids. The deficiency of spleen can be observed in the face if the face and the skin is dry and perhaps warm. The most important what the patient has to do, not to smoke and not to drink, not to eat too fat milk. In an abundance of dampness, you have to reduce fat, sear, milk, corn, and raw dishes. Stagnation means the deficiency of the liver chi. Blockades are a problem of the liver chi, and these blockades can affect the fluids, the blood, and the chi. If the blood is affected, you have blue vessels, you have acne, you have inflamed pimples. If the chi is deficient, or there is a disturbance of the chi, you can observe cramps, strain, and motionless. But the most important of everything, of every treatment, is to lead through the Shen. Lead through the Shen to you, and lead your own Shen through to the patient. Shen is stored in the heart, but not really stored. The heart should be open for Shen. Your mind should be open for the patients. And then, in this case, you have contact to the patients from heart to heart. Shen is an aspect of the heaven. It goes to the heart and goes through the heart and has its expression in the face. In your face and the face of the patient. And if you reach with your Shen the patient, that is a minimum 50% or 99% of the treatment. But you have a heart which is free. If the heart is blocked by emotions, by bad emotions, or any other emotions, the treatment will not be successful. So you have to observe yourself if you treat the Shen of the patient. Okay. If you reach Shen, you will reach the patient. You have to look to the brightness of your eyes. You have to the connection Do you have real connections to the patients? Can you reach the patients? You should ask this. Can you really feel what are the emotions, the feelings of the patients, or not? I have some patients who came to me since 20 years, and I really don't have the feeling. And other patients who are coming just the first time and see, okay, the connection is good, and I can help them. But there are patients who cannot get a connection. That's true. It depends on the communication and the time for the communication. Sometimes it's difficult, sometimes it's exhausting, the communication. But it has to be. Next one. And we have, say, some places for the Shen in the face. We have the colors, cataract, for the fire of the heart, or is it perhaps the fire of the liver? The same, sometimes the same signs in the face, the red symptoms, red face, as the fire of the heart or fire of the liver. Or you have to observe some locations, the point yin tongue between the eyes, or the area below the eyes, who are the signs for disturbances of the stomach, perhaps. And you have to observe the moving of the muscles. What happens with the muscles during speaking? Some people are speaking without moving the face. That's the problem of the stagnation of the chi of the heart. True beauty pains comes from the inner. Treat the individual, treat the whole patient, and use the network. We have with acupuncture a wonderful, a really great network of energy which we can use. And use the columns of Chinese medicine, acupuncture, kosmetischen, other techniques. We have a great variety of techniques. You can need herbs, use herbs and diet, massage, exercise, and so on. Use the full spectrum of the Chinese medicine. I believe I don't have more time. In the workshop on Monday, I will tell you something more about techniques, about acupuncture points, seldom and often use acupuncture points. I will demonstrate several techniques and tell you more about the treatment of skin or cellulite or swelling and so on. Next week. We have acupuncture points we use very often, like large intestine 4, but another point like large intestine 6 is very seldom used, or large intestine 7 is seldom used. So this